So, the Holy Grail is for us to be able to identify people that have cancer before they have cancer. And there are multiple, new liquid biopsies, right, in the market. Our group wanted to also explore the possibility of having a combined panel. And we had a group of individuals that had, cancer that we knew of, some others that had polyps, that is the polyps that are the precursors of cancer in the colon, and also people that were healthy. And we wanted to test septin-9 because that was a biomarker, a protein that had been approved before by the U.S. Preventive Services Task Force, I think about 7 years ago. So it was actually part of the alternative methods for colorectal cancer screening that happened about 7 years ago. In the last reiteration of these U.S. Preventive Services Task Force, they didn't include septin-9, so it was removed because the sensitivity and the specificity were not as robust, so it was not included as part of the alternative for colorectal cancer screening. So we wanted to look at that, but then we also added other potential proteins and genes that could enhance the capacity of us to detect people that have cancer before they actually had symptoms. So the study is a pilot study. It took a few years for us to do it, but at the end we were able to show that the diagnostic accuracy was about 75%. It's still not perfect, right? The best screening test is the one that it's extremely high in sensitivity and extremely high in specificity, right? But it's another, step forward to try to develop, methodologies that are biomarker, and tumor, agnostic. In this case, it was really the proteins that we look at were expressed in the colon, but they are also expressed in other tumors. So I think as the data continues to evolve, we're going to be seeing blood-based biomarkers, right, in different flavors of liquid biopsies that will allow us to continue to, push forward the envelope. I mean, we still have a big issue with not everyone wanting to undergo screening tests, right? So when you look at, especially for, groups like Hispanics and, some other communities that, they basically men too, they have lower, adherence to screening tests. So if you could move screening from a colonoscopy-based screening, which is what we do right now for colorectal cancer, to a blood-based screening, the adherence will be higher. And if we can have a higher adherence, we can diagnose early. And if we diagnose early colorectal cancer, the survival at 5 years is above 90%. So that's what we're trying to do. We're trying to contribute to the discovery of new biomarker panels to help screen for colorectal cancer.